start the recording, so just give me a second here. I think we are streaming. Now I'm gonna record. Okay, we are recording, so we are good to go.
All
Julia,
right.
take it away.
Good evening, everybody. It is Monday, January 11th at 6:30 p.m. 2021. First, we will do I don't think we really need to do a roll call because Jeff is seeing all the attendees that have joined, correct?
Yep. Yeah, that's fine. I'll just get it off the list here, so we don't need to worry about it.
Perfect. All right, so the first thing we will do is we will approve the meeting agenda. Please.
You can all see this, right?
Yes.
Okay.
I move to approve.
Second.
Anybody opposed? Please speak now. Agenda approved.
The second, was that Tracy?
Yeah, sorry.
Yeah.
Okay, cool.
Next, if Jeff could scroll down, we will approve the meeting minutes from December 14th.
Motion to approve, Andrew.
Do we have a second?
Second, Greg.
Okay, Greg seconds. Is anybody opposed? Okay, and minutes have been approved. Jeff, did we get any community comment on anything?
0.
Well, that was quick then. Okay. Report, we'll move to the next section then, reports and recommendations. Subcommittee updates. I do not have anything for subcommittee 1. I don't know, Philip, if now you want to talk about anything, or if you want to wait for member comments.
Let me just say that I have not started my side yet because I just published my first today. So, but I'll talk about that in the staff comment and the member comments. But
Perfect.
we'll start on that as soon as I can.
I look forward to hearing more in the member comments. I want to hear about it. Amanda. Okay. The second subcommittee, any updates?
We had a discussion earlier today with an owner of a few different apartments and condos in Minnesota and Texas, just so we could get some more background information. And we're going to meet with some more in a few weeks. So we're still just getting that information.
Great.
Cool.
And anything from subcommittee 3?
I have to confess, I haven't done anything except looked at a few other sites that didn't excite me. The one thing that occurred to me is that we don't actually know what's being done, particularly in the school system. And so that's a project that I may take on myself in the next month or so. We haven't had any meetings. I don't know if anyone else in the group has anything to add.
So we're talking about the social connectedness one here, right?
Oh, no, this is the opiate.
Oh, okay. Never mind. Oh, we took that one out of there. That's the first one. Never mind. Okay. No, I'm just saying, I was in a meeting on Friday of Metro Public Health Directors, and there's a group that we are we're a part of. It's called I can't remember the name. It's a coalition basically of public health, medical, kind of different organizations across, healthcare, and it's this big picture public health organization. And one of their initiatives is around social connectedness and isolation. And so I asked if I could, because I'm not a big part of that or haven't been attending that, but it perked up, my ears perked up, because that's exactly what we've been talking about for Initiative 1. So I've got one of the other members of the group is kind of introducing me to someone that I can get in touch with about that. So more to come if anything comes out of it, but they're doing they're going to hire a vendor to do some work in that area.
Oh, cool.
So I said, well, if our group and this group talk to each other, maybe there's something there. But anyway, so more to come on that, I guess, later. Sorry, I didn't mean to hijack the discussion there.
No, please share what you find out with group number 1. That'd be great. I know we've had holidays and a lot of craziness since we last met, so I understand that everyone's been busy. Is there anything else from subcommittees?
This is Tracy. Our group, as Issa said, we met earlier today, and we had a question: is there a template for a recommendation deliverable, so that we can see what people have done before, so we're not kind of starting from scratch, just when we get to the point that we're ready to actually put pen to paper?
Yes, there is. I can get that to you. It's basically called an advisory communication.
Okay.
I'll see if I can pull it up here.
If you could just get it to us sometime, Jeff, that's fine. But
okay.
Yeah.
Yep.
Thanks.
I'll just send it out to the group.
Anything else? Okay, we'll move on then to the topic of the times, COVID-19 update and discussion.
Sure. So kind of where we are right now is the city first responders had a clinic on Thursday and Friday of last week, and then tomorrow is kind of our 3 that we set up for those folks. It's been an interesting, I'm involved in the periphery because I'm not a nurse. I don't give the shots. This is part of our contract with Bloomington Public Health. They've really been, putting on, it's like they're doing a flu shot clinic basically, but they're coming in and doing the clinic. And, it's like two vaccinators and an admin person come over and do the clinic. And it's been interesting because we've struggled to some of the sessions we did a morning and evening to try to get people on and off, coming off shifts, because the police officers work 6 to 6, and sometimes the paramedics have unique shifts and stuff. And the response has been okay, but not great as far as trying to get in to get shots. And I don't know if the hesitancy is because they're nervous about it, or they're going to be on vacation in 28 days, so they can't do the second shot or something like that. So I'm sure there's a range of possibilities. So we had good turnout for like Thursday, both sessions, but then Friday we had to try to fill in because the vaccine comes in a vial of 10 doses, and we didn't want to open like a second vial. If we had 15 people, you open that second vial, you need to use those 5 extra doses. So there was this, okay, and some of the sessions only had 5 people signed up, so we were going to cancel them. So what we ended up doing is working with Bloomington and Richfield, and we got Richfield first responders to come over to the Edina clinics. So our 3-city arrangement actually paid off really well there, because we could make sure that we were not wasting doses. So and that's probably going to happen tomorrow too. So that's been going well. We're talking about moving on to the next tier in phase 1A. So there's all these categories. I'm going to stop sharing my screen so you guys can see me. Anyway, so there's all these and I got to start my video. So the phasing is a topic of discussion a lot. So who's eligible when people can get their doses, that type of thing. So, and that's still kind of being developed as we speak. So that's kind of where we are. The next phase is going to be a big, when we start to broaden out the numbers and the categories of who can get vaccinated. It sounds like the Mall of America is going to work out for a site, and figuring out the throughput for that. It's going to be interesting if that's sufficient, or if we're going to have to figure out more sites with more staff and more support and logistics. So I don't know how that's going to go. So we'll kind of have to we're going to kind of see. I'm encouraging us to talk about those secondary sites. Like you want to set up at a church or a community center or the senior center or something like that, but we need to have staff to support it, and we need to have doses to give. So there are some limiting factors in those types of places. So that's kind of where we are. If anyone has questions or wants, comments, that's what I've got to tell you, I guess.
How will we know when, like, the next group of people to receive the vaccine, when they're moving to that step? What kind of word will we get? How will we know that? Because I'm just wondering about that.
Yeah, I think basically when we make that shift, it's going to be blasted out anywhere we can blast it. It's going to be news media, print media, social media. It's going to be everywhere. So I don't think it's going to be an issue hearing about it, because we're thinking about like people that don't use the internet, don't have a smartphone, older folks, but they might listen to WCCO, they might read the Star Tribune. So it's going to be in lots of places.
My daughter is the director of communications for Health Partners, and she assures me that it will be virtually impossible for people to know when phase 1B and then 1C and so forth comes online. The other good news is that Health Partners at least expects to be able to move to 1B this month, which includes first responders, people over the age of 75 and so forth, with the expectation that by the end of February or very early in March, depending on whether the Johnson & Johnson vaccine is approved in early February, that 1C will come on board, which is everybody over the age of 65, plus those with particular vulnerabilities because of pre-existing conditions. But the communications from I wouldn't rely much on the federal level early on, but from the state level, as well as from the individual hospital systems, Alina, Health Partners, Fairview University, should be excellent and impossible to avoid.
And that's all similar to the messaging that I've heard too, for what it's worth.
Hey, Jeff, I've got a question on the logistics of the vaccine, because I know it's got to be stored at a very like 25 below type thing. Can you walk us through from the time you pull it and the shelf life and the temperature and all that?
Well, I don't actually do any of that. So, I mean, I know.
I don't mean to put you on the spot, but I was just curious.
And that's a good question. I mean, like even like Bloomington, they only have, let's see, I'm trying to think how they do it, because they don't get, they have to request it and then get it like the day of the clinic. Like they can't store it because they don't have one of those freezers. So I think Hennepin has one, and
Dakota County does.
yeah, Dakota has one, or is getting one. And
They
then
have one.
They have one, and then Anoka, I know Anoka County had one. They bought a refurbished one that it like didn't work, so then they're on back order for another one. So, but that's it. So basically, I think the state has it, and then we get it, you know, the day of the clinic, and it has a certain shelf life. I don't think it's more than a day. So
it's 5 days after it leaves.
Okay.
It's 5 days after it leaves super cold, but it still doesn't mean it. I mean, it still has to be refrigerated. It just doesn't have to be super cold. But it also depends on which vaccine and how many doses are in each vial. Like it's a whole.
There's a formula.
Yeah, there is.
Yeah.
I
So
have to ask Dakota more, but I know they had the formulas down.
yeah.
I mean, this has kind of been covered already a little bit, but do we know, is there an easy way, and like Jeff, is for you, and that Julie actually might be able to answer it as well, but is there a way that people can kind of go on and sign up? I mean, I know we kind of said that it'd be impossible to miss, like short of, you know, an airplane flying over with a banner that says, you know, it's time for you to go get your vaccine. Is there a way that people can sign up, you know, just to get a text message, you know, just like, you know, I know there's privacy concerns, but just, you know, enter like minimal amount of information, and that way they'll get a notification like the second that their group is kind of up. You know, since we all, you know, everybody has phones, so that seems like a really straightforward way to do it. I just didn't know if that already existed and we could direct people in that, you know, in that direction.
I have not heard of that happening. The one thing that's happening a lot for us now is like some unaffiliated clinics or healthcare, you know, providers like dentists or a small mental health clinic or something like that. They're calling and saying, okay, when is my turn? And we have there's like a metro coalition of health departments that has this survey that they put out for clinics to put their information in, and then they get put in this database, and then we have a record of, you know, this is what they do, and then that gets forwarded to the applicable department of who's going to coordinate with them. But as far as individuals, no, I'm not aware of something like that.
That's a great idea, though.
I mean,
It seems like a IT. I don't want to say. Seems like a handful for IT, but that's a good idea. I can always bring it up. I'll see if there's something that I can find out. I don't know.
I mean, yeah, it's one of those things where you could do it and collect minimal information. Like I know that's been a big concern with like the COVID, you know, the tracking stuff for everybody, and like I respect that. So, but you know, just if it's something where, I mean, obviously you need to provide a phone number, but you know, your name's not necessary. It's just, you know, put in just check a box and select an age category and get alerts for that category when, you know, when it comes up.
Yeah.
But you know, again, it was more, I was more just interested if there was something already. I'm not again trying to put more work on an already, you know, overworked group, but it was worth asking.
No, it is going to be interesting about how do we keep a governor on the flow once we start to really open up the system. And it's probably going to be appointment based, or you have a window of time when you can show up to the Mall of America and you're shot. But you know, it's going to be like a fire hose, I think at some point where everyone wants to go, and we just have to figure out how to manage the capacity.
Yeah, it's going to be, I would imagine at some point similar to the H1N1 vaccine distribution.
Mm-hmm.
There is a new calculator that people can use. I put a link to it in the chat. If people are wondering about quarantine times or anything, that's new in the last week or so. So you don't have to put any of your personal information. It doesn't ask you for anything. You can just click what is going on in your life. So if you were exposed or anything like that.
Speaking of that, for those who may not have heard already, there is an app available from the state. If you keep your Bluetooth turned on your cell phone and are in contact with anybody who later is reported to be positive for COVID-19, you will receive a notification that you have been exposed to somebody with COVID-19. I put that app on my phone and nothing has happened, thankfully, but do have a friend who is a frontline worker and has received notifications of being in contact with someone else. And I don't quite know. I suppose I can look at my phone and find the name of the app. But if you don't have it, it's probably worthwhile having. Let's see. Of course, the problem is, as I look at my phone and the number of apps, it could take me a year to work my way down.
I think it is called COVID Aware.
Yes.
Looks like.
Yes, you are.
Again, that one? No. Yeah. Bottom.
COVID Aware.
That one. COVID Aware.
COVID Aware. COVID Aware MN. And, you might want to get your friends to sign up as well. There is no identifying information. You just get a text if you happen to be exposed, but they don't know your name or anything else. It's just a Bluetooth to Bluetooth communication.
I might have missed something or misunderstood. Is there a quarantine time after the first vaccination where you should self-quarantine? You don't? Okay.
No, it's not a live virus vaccine.
Nope.
Yeah, Julia, I think what Julia had shared was just a updated calculator for people that might be, either you were exposed to it or you got it or you were, it helps people kind of figure out how long they need to quarantine in order to make sure that they're not going to expose anybody else. But I don't think it was in relation to the vaccine, just kind of an also, by the way, this is new.
Yeah, exactly.
I think as far as the app is concerned, I think that the person who has COVID has to be identified with a number. And then there's a matter of whether or not the number is actually in the app itself, which, I don't know who exactly puts it in there. But I think unless that number is in there or something, I don't think you get that. I don't think you get a notification if no number is for the individual's been put in. So I don't really know how all that's working, but that's my take of it.
Yeah, my understanding is that I have to have it on my phone, and then if I test positive, then I have to be interviewed, and that once that interview, when I have that case interview, then that number, I'm given it by MDH or somehow MDH assigns it to me, and then it goes in the app, and then from there, that information would be transmitted, from your Bluetooth, or not from your Bluetooth, but because you've had your Bluetooth on, that information will be transmitted to a potential close contact. Anything else COVID related? I will take silence as a no. Okay. I know we have at least one member update from Philip. So Mel, Philip, if you wouldn't mind, we can start with you, and then other people can give updates when you're done. If that works.
That's fine. That's
Perfect.
fine. I am pleased to tell you all that I am up and running now. All my business stuff has been done, and my business is now in progress. I published the pilot introductory last night, and seeing there is this chat app right here, I'm going to share a couple of links with you. I spent the time between Christmas and New Year's building the website. So here is the. Just gotta get my mouse back over here. Here we go. All right. That is the web address for the site, and you can use that to find the pilot. For podcast information, and then what's called the new podcast episodes. The other one is I can give you the direct link to the actual. Yes, I can give you the link to the actual app where you can hear it for when when you want to. But that right there is the link to the actual episode. According to my information, it is already available on Spotify and Pocket Cast at the time, but you can also hear it in that address. The Anchor is my platform that I use to record it and publish. But it is out and available. The introductory is, and basically, it's my explanation about why I'm making the podcast. I talk about the format of the podcast, why I'm making it, and the subjects I plan to discuss, along with the questions I'll be asking. The second segment is my list of do's and don'ts that I'll do on it, and then the last segment is a little bit more about myself, my own journey from being diagnosed to that's led me up to this particular point in time when I'm beginning the podcast. So I have a couple of good advertisers, and there's also a right after the first segment, there's a message from Ellie Wilson. She is the executive director of the Autism Society of Minnesota, basically announcing awesome support of the podcast. So I've got those things coming up, and I have some shows lining up. This was the introductory. The very next one's going to be about COVID-19 and its effects on autistic adults. The following one is going to be about neurodiversity. I call it, we say that autistic adults in our own brand, make, and model. Each of us has our own unique brand of autism. And then I'm going to be doing one about the aging autistic community. And I'm setting up to do one coming in March that's going to be on the subject of autistic adults and ableism. And that one will be extremely exciting because the person I'm going to interview for that, I have to walk just a tiny step over some partisan politics here. Just say this one, just a little bit of a step. But her name is Sue Swenson, and she was the, here we go, the Assistant Deputy Secretary in the Office of Special Needs and Rehabilitation in the Obama administration. And she is an excellent speaker about autism. She had a son, Charlie was his name, who had both autism and he was developmentally challenged as well. That he passed away when he was 30 years old, unfortunately, but she has some remarkable stories to tell about him. Anyway, she's going to join me to talk about the issue of ableism, which will be very important. But my days are really not boring. I promise you that. I'm really like, I'm just so amazed at what it takes to actually create a business like this. I mean, I feel like, you know, I've never done anything like this before, so I'm like covered with something to do pretty much all the time right now. And I'm still getting all my equipment set up. So one of the pieces of equipment that my grant helped me get is this laptop I'm using to talk to you on. So that I can use. So there's lots to come on this. It's going to be very exciting, and it's going to be it's already an adventure, so it can only continue to be an adventure. I posted on my Facebook today something that's a little funny, but I said, borrowing from an old Navy campaign ad, this is both a job and an adventure. For those who even remember what that ad was. Anyway, so that's what I have to say, and now that I'm getting to this, I can finally start working on that first initiative project that we've been setting up. I also wanted to kind of get past these last couple weeks, and of course next week's going to be full of all sorts of things going on. So, but anyway, so the point is I'm up and running, and the business is now in motion, and this is just an amazing journey I'm on to create this. So I welcome you all to listen in and check out the website. Like I said, I've been putting it together. It's all come together. I'm on Twitter, Facebook, and Instagram. Instagram is where you can find me. Find today's art. Yeah, so that's where things are at. And I don't have anything more to say about it. I'll take up the rest of the night. Just kidding.
Philip,
But yeah. So.
Philip, do you have a title for your podcast if I end up needing to search by title?
Today's Autistic Moment. Okay.
Thank you.
You're welcome. Today's Autistic Moment, a podcast for autistic adults by an autistic adult. That is me. So yeah, so that's this title. Like I said, if you click on the links that I gave you, it'll take you to the website. One will take you to the website, and the other one will take you to the app. It's Anchor FM. Will take you to that app where the current one is published. And just since last, let's say I published it about 2:30 yesterday afternoon. It's had 17 plays so far. So I suppose that's a good number. So
I think that's great.
yeah. But I've been working on that one ever since I started thinking about this in September. So I've been able to finally pull all of its pieces together and get it to run. But anyway, this is very exciting, and I really look forward to seeing what this does for the adult autistic community in so many ways and places. Right now, it is centered, of course, here in Minnesota because that's where my resources are right now. But we'll see how far it goes. I'll give you just one little snippet of what I said in my list of do's and don'ts. For example, I don't accept the use of high functioning or low functioning labels for people with autism. I also don't really accept terms like severe or mild forms of autism. And then I'll tell you why. When an autistic person is labeled as high functioning, the expectations are too high and our challenges get set aside. One example is that when an autistic adult who goes to apply for disability benefits and or social services, they often get denied because they are, quote, too high functioning. When an autistic person is labeled as low functioning, there is a very damaging effect of presumed incompetence. And this presumption is very cruel and devastating on the autistic individual and their caregivers. And we also know that autistic individuals with higher support needs are not incompetent at all. So that's sort of a snippet of something I say in the podcast in the intro. So anyway, so there's all that, and I do appreciate the support of this commission for this project because it's my really big deal. So anyway, so
Philip, I'd be happy to
Yeah.
know. Googled today's autistic moment, and I got, there you are.
that holy moly!
And at the bottom of that is the link to your, I don't know, people probably can't see that, but there's the actual link there. So you're already
Wonderful
into the cyber universe.
Is that off of Awesome's site?
I'm sorry, say that again.
You said that was on Google?
Yeah, I just used my Pixel 3 and put in the title of your podcast, and that's what came up.
Wow. Okay. Well, that's good news. Yeah. So yeah. See. So yeah. So yeah. So thank you very much for that. I'm glad to know that. Oh, thank you. Thank you. Like I said, this is I never even thought until August. I never even thought about doing anything anywhere near like this. But all of the pieces that have come into making it have gone extremely well. I mean, this has been all of the encouragement I've gotten, the support I've gotten to make it happen has been overwhelmingly positive. And so now we'll see exactly just how far it goes. But everything starts from a beginning and it has to go and grow somewhere. So, but if it's off to a good start to begin with, then that's what I care about right now. So,
well, that's great.
Yeah.
Great.
So, yeah. Okay.
Thank you for sharing.
Okay.
I look forward to listening to a podcast very soon.
Thank you. Thank you.
Are there any other member comments?
I have something.
Yeah.
So I don't know if any of you guys are aware, but last week there was an open letter published by a group of Edina community members to the school board talking about how they wanted a 5-day full in-person return to school. And then in response, me and some other members of my school's newspaper also wrote an open letter to them. And it kind of dissected their letter. So I would just I urge you guys to read it because I feel like it gives a pretty good view of the student perspective. So yeah, that's what I have to say. So I can link it in the chat. But I think it's a pretty, we worked really hard on it, so we would love it if you could read it.
Yeah, please post it in the chat. I'd like to read it. Was the initial letter, where was it posted?
There's an Edina Parents for Progress website. I think that's where it was initially posted. And there's also a petition that's gotten over 500 signatures.
And is it 5 days in person for middle school, high school? Because K through 5 will be transitioning to 5 days within the next month.
Yep, I think they were saying a 5 full person return for high school students and middle school students.
Okay.
If I remember correctly.
Yeah, I haven't heard if I haven't heard anything about transition for middle school, high schoolers. I mean, the county numbers and the city numbers are down. They're under 30. Last I checked. They do them every week, so I don't know. I don't know what they'll do, but yeah, I'm gonna read that. Any other comments?
What's the name of the website that letter is on again? That the student's response is on?
The student's response one is edinazephyrus.com.
Edina what?
Zephyrus, ZEPHRYS, or something like that.
RY
I linked it.
RYUS?
Yes, sorry. Can't
Alright.
be on the spot.
That's all right.
And the initial letter was on Edina Parents.
For progress.com, something similar.
Okay. Any other comments?
No.
There's
your 7 seconds.
Yeah, I was just gonna say that's my awkward 7 seconds. I've been doing it in Monday morning meetings. It's like the slowest 7 seconds in the world. Okay. Well, if we don't have any more comments, then I totally lost the agenda.
Yeah, I closed
But
it. It's just staff comments after that, and that's it.
Okay. Any other staff comments, Jeff?
I really don't. We're kind of in this weird, just trying to get to the vaccine time. And if you're not directly involved in that, your day to day really hasn't changed as far as like staff. So the people that had to come in, and do work in person are doing so. People that didn't are not. So it hasn't really changed much until, except for like our first responders and stuff that are getting the vaccine. So hopefully that changes in the next couple months, but I really don't have a big adjustment.
Did you have any businesses that were correction, do you have any restaurants that were defying the orders?
No, we did not
Okay.
get notified of any that were in defiance. I don't believe. Let me try to think back here. I don't think so.
I feel like you would have hit the news.
Yeah, none that
You would have
made a
gotten
big deal.
doxxed.
Yeah, but there were a couple that I thought might, and they didn't. So
Okay. That's good.
overall, your situation at the county, after the initial kerfuffle, did it go okay?
It's settling down. I mean, the calls and letters are fewer and far between. So I guess I can just say this to everybody. So with not the current executive orders, but the one before, that it would not allow indoor on-site consumption. There is a group called Reopen Minnesota, the Reopen Minnesota Coalition, Reopen Minnesota something, and who were against the executive order, and there was a lot of businesses and other support for it. And as part of environmental health and health inspectors' jobs, it's also to enforce those executive orders, including on-site consumption bans. So we had a couple of our staff go out to a place that was defying the order. Everything was fine. And then I don't know if it was later on a day or the next day, they got doxxed on Facebook. So what that means is that they took our business cards and took pictures of them and posted it on Facebook. And which meant people were getting calls and emails, and I can't really go into it too much more than that. But it wasn't a good situation, and it definitely initially was fine, and then just kind of became disappointing. I don't know. It's hard because we have really good relationships with our businesses, and to see that happen is really is really concerning. But
Well, and it really wasn't.
Everyone's safe.
It really wasn't the businesses that it got out of hand, and it got away from the business people really fast. You know, it turned into this whole other thing, especially with what's going on in the country. And, you know, for me and my staff, you know, we know Julia's staff and her group, and, you know, you see it and you're thinking, oh my gosh, well, you know, that's coming to us, you know, that's going to happen. And, you know, to be in environmental health, you're used to no one knowing at all what you do. I mean,
Sure.
you are so behind the scenes that you have to take an hour and a half to explain to somebody, this is my job. And for it to be out in the, you know, in the universe now, and people paying attention to it and making assumptions, and we really got concerned for our colleagues, and then concerned for our group, I guess, as a whole. And like, what's going to happen? Is somebody going to show up at someone's house and do something? And hopefully,
that was something that was threatened. I mean, it was.
Yeah, that was a legit possibility.
Yeah. So, but everyone's safe. But it's, you know, there's a couple hundred inspectors in the entire state. I mean, prior to COVID, we saw each other a couple times a year. So it's a pretty tight knit community. And, you know, there's people that I've known these people for over 15 years. So to see someone's like character attacked when you know people it's just kind of sad. But everyone's fine. So we move on. We're used to not having people like us, so it's okay. Yeah. Anything else? All right, so we'll check out Philip's podcast. We'll look at the article about Issa's article about reopening schools 5 days a week.
A rebuttal to that. Sorry.
Rebuttal. Yeah. No. Sorry.
Or just
Thank you for the
dissection
correction.
of their argument. I just wanted to.
I'm actually looking at it right now. I'm looking at it on one of my other screens. So
yeah,
I'm already there.
I'll be looking at it as soon as we end this meeting. I tried to click on Philip's link earlier and it wanted to like end my WebEx, so I quickly didn't do that. I'm like, no. So okay. Well, if there isn't anything else, maybe there is.
It's Tracy. I'll move to adjourn.
Second.
Yeah, sure. Perfect. I like it. All right, our next meeting is February 8th. Is that correct, Jeff? You can't hear me?
You're muted.
Okay.
Yeah, that's what I've got.
February
That's
8th.
second Monday.
All
Yep,
right.
February 8th.
All right.
Same place, same time.
Sounds good.
All right.
All right. Have a good
Thanks,
night,
everybody.
Thanks, everyone.
Everybody.
Have a good evening.